Welcome to our program. I'm Frank Long, Editorial Director of Rehab Management. Healthcare has learned a lot about COVID-19 since it moved center stage back in March of this year. We now know that some individuals who successfully battle the disease as inpatients may face a long recovery curve. This population is now sometimes referred to as the COVID-19 long haulers. The long haulers pose a special set of considerations for rehab. Gaylord Specialty Care, headquartered in Wallingford, Connecticut, decided to address those needs by creating its multidisciplinary COVID-19 recovery and rehab services. We're going to learn how this program was built, what makes it work, and the roles that occupational therapists and physical therapists play in it. Giving us an insider's view is Dr. Jerrold Kaplan, Gaylord Outpatient Medical Director. Dr. Kaplan, thank you for joining us.
And thank you, Frank.
To start off with, can you provide a little background about Gaylord and its battle with COVID-19?
Sure. Gaylord is a long-term acute care hospital in LTAC in Wallingford, Connecticut. We've been in existence for over 100 years and take care of patients with medically complex issues as well as complex rehabilitation needs. Gaylord has a full inpatient hospital as well as an outpatient campus here in Wallingford and several satellite locations. So we began our COVID experience at the end of March with our first patient admitted and then into April and subsequently. And what we found is patients were coming to us from the acute care hospitals with severe pulmonary disease. Many of them were ventilator dependent, and we weaned them off the ventilators here at Gaylord. But they also had complex neurological needs, cardiovascular needs, balance issues, weakness, fatigue, disability issues. So really required a full rehabilitation team process. At the point in time when patients were first admitted to us from the acute care hospitals, we didn't know how long COVID symptoms were going to last. So we did not have a special outpatient program in the beginning of the COVID pandemic. What happened then was our therapists were really the drivers for our COVID recovery program. We had a support group which was started by our inpatient therapist, physical therapist, occupational therapist, and other members of the Gaylord interdisciplinary team. And we heard directly from our patients that they needed more services, that they were experiencing months down the line problems with weakness, fatigue, what we call brain fog in terms of cognitive impairment issues, ongoing pulmonary issues, balance issues. So together with the team here at Gaylord, we built an outpatient COVID recovery program.
Doctor, what challenges has COVID-19 created, especially for the rehabilitation inpatient, outpatient population? Has the virus complicated care for this group?
Well, Frank, as you know, rehabilitation is an interdisciplinary model, all the therapists working together with the patient and their family. Unfortunately, on the inpatient side, because of the infectious disease nature of COVID, the treatment had to be provided, at least initially, in the patient's room. So they weren't able to have the benefit of the therapists working together in a gym-type setting, nor the ability to use specialized equipment. They also didn't have the social interaction with other patients. Once patients were discharged home on the outpatient side, initially when we had the peak time in COVID, we weren't able to provide all of the services in our outpatient arena. So many of those services actually had to be developed in alternative models like teletherapy. So our therapists did a terrific job of designing an outpatient program both on-site and via telehealth.
Why did Gaylord Specialty Healthcare develop its COVID-19 recovery and rehabilitation services? What sparked the idea and who does it serve?
Well, Gaylord has always been patient-focused, and we've tried to look at a patient not just from a knee or a shoulder or a hip, but as a whole person in a holistic approach. So our patients were telling us about all the other issues that they were experiencing. They were following up with their pulmonologist for the breathing type problems that they were having, but nobody was really treating the other symptoms. So the patient was really built based on patient and therapy input that we needed to service the whole patient. So putting together a specialized treatment program that recognized the complex needs of the COVID population with the fatigue issues that they felt when they tried to do exercises, the breathing problems, the dyspnea that they had, balance impairments, as well as the cognitive challenges, which made the therapist have to work extra hard in terms of designing a home program for patients that they could work on with their families.
Tell us about the technology, process, or policy that equips Gaylord to help patients who have been affected by COVID-19.
Well, Gaylord is fortunate enough to have very, very experienced therapists who are trained on a variety of specialized equipment. So with the issues that we're faced with COVID, we have specialized pulmonary treatment that we can do from the pulmonary rehabilitation aspect of things with our physical therapists as well as respiratory therapists. We have specialized equipment that we can use for the visual deficits that COVID patients might have. I'm not sure if your audience is aware that COVID, in addition to being an infectious process, also has autoimmune features which can attack any organ system in the body. Newer studies are also showing that COVID has a hypercoagulable state that can cause symptoms similar to strokes. So many of these patients are coming to us with not just the weakness and fatigue issues, but they have many symptoms and features similar to stroke patients. So they may have visual impairments. So our occupational therapists who are specialized in treating vision dysfunction can use various pieces of equipment such as the BITS machine for visual deficits. If they have severe weakness, we can use various unweighting type devices in our therapy gyms. We have specialized balance equipment that we can work on for balance problems with patients, everything from a balance board to specialized treadmills that are set up that we can mimic various situations that impact the patient's balance and coordination activities.
To give us a sense of the effect the services are having, can you share a case example of a patient who has recently been through the program?
Sure. Unfortunately, COVID has impacted many healthcare workers. So I have treated doctors, nurses, directors of nurses, APRNs, frontline workers, including security guards in hospitals. One particular case that stands out is a very phenomenal woman who was the director of nursing at a skilled nursing facility. She developed respiratory symptoms at the end of March, which would have been the first COVID wave. And initially she was tested. They thought she had influenza because we really didn't know much about COVID. And then she wound up testing positive for COVID and had a decline in her cardiovascular status to the point where she became ventilator dependent. So she was transferred to Gaylord from an acute care hospital on a ventilator, severely debilitated. Unfortunately, the COVID attacked her other organ systems, so she developed diabetes. She also developed cardiovascular issues with new onset atrial fibrillation. She had hypercoagulable state, so had to be put on blood thinners to treat her condition. So she really was impacted with a full body perspective, as well as psychological trauma from the COVID experience. So she went through Gaylord's inpatient program and then started in our outpatient program. And our therapists put together a very dedicated program. The physical therapist worked on a program both in land and aqua therapy. Gaylord is fortunate enough to have an Olympic-sized pool that we can do all sorts of aspects of aquatic physical therapy. So we worked on her strength, her flexibility, her endurance, her balance in physical therapy. She also had a lot of cognitive issues. So she worked with our speech therapy department on cognitive issues and worked on her overall coordination and plan. And I'm delighted to say that through that combination of inpatient, outpatient therapy, as well as a tremendous amount of hard work on the patient herself, we were able to get her back to work. She's many months out now from her injury, and unfortunately, because of the severe fatigue, she still can't tolerate a full day's work, but she's back to work on a part-time basis, and most of the aspects of her COVID condition have recovered. the fatigue as well as some mild cognitive deficits are probably the two biggest issues that she still faces.
I'd like to talk about telehealth. Can you tell me how telehealth is integrated into this program?
Well, COVID was actually the push for us to develop telehealth and telemedicine at Gaylord Hospital. In March, when COVID was becoming a known phenomenon, I got a call on a Friday afternoon about 3 o'clock from the CEO of Gaylord Hospital that said, Jerry, can you put together a telehealth, telemedicine program for us? So we took a team, we worked all weekend with various members of the Gaylord staff, IT, clinicians, doctors, therapists, to come up with a telemedicine platform. We had to review all different providers. Most people are familiar with Zoom. We actually are using a Doxy platform, which we found worked well for our patients and their families. And we put together this telehealth program. Now, from the physician side, initially we started telehealth just as we're doing now, talking and going through some examinations. The therapists even had a harder time because doing therapy via telehealth is more challenging because you don't have all of the specialized equipment at home. But our occupational and physical therapists stepped up to the plate and were really terrific. We had one particular occupational therapist who designed a home vision rehab program. He made tapes for patients and their families. They developed home vision therapy exercises, coordination exercises. We actually mailed TheraBands home to patients with home instructions. Sometimes we had them get light weights. Our physical therapists worked with them. The therapists loved actually doing the telehealth because they could do home visits. So they had patients' family members go throughout the house. So they were able to see where their tripping hazards with rugs. What type of stairs did they have to get into the house? Did they have an accessible bathroom or not? So the therapist actually gave me the feedback that telehealth was a tremendous addition to their repertoire because they could do home visits now on patients that they could never do in the past. It also was great for me as a physician because you can get accurate medication identification. Many patients get prescriptions from lots of different physicians and are not quite sure what they're taking or when they're taking it. They can actually go to their medicine cabinet, pull out the pills. We can go over what they're using. The therapist can do a home assessment for them and watch them get in and out of particular chairs that they might have, see how their bedroom is set up, see how their bathroom is set up. So it was really a tremendous benefit to be able to utilize technology to learn together a new exercise program, but also to be able to do a home assessment.
COVID-19 long haulers seem to have a wide spectrum of residual effects that includes physical disability as well as emotional and cognitive issues. Dr. Kaplan, to what extent are therapists involved in dealing with this mixed bag?
The therapists have been critically important in terms of working with patients, the long haulers, with both the physical, cognitive, and psychological issues. Since the therapists are working so closely with the patients on an ongoing basis, patients feel comfortable with sharing all of their issues and concerns. Many of the patients actually have anxiety issues, depression issues, because they can't do as much as they had hoped to do because of the severe fatigue issues, or their thought process is not as sharp because of the cognitive impairment, which we're calling brain fog. And then if patients do recover enough to be able to return to work, many of them have issues related to post-traumatic stress disorder. They got COVID from working in a particular environment, and now we're asking them to go back in that environment where COVID may still be rampant. We think that there's an immunity from COVID, so patients won't get COVID again. And some of the newer studies that are coming out now show that that immunity looks like it's lasting at least 8 months or longer based on the data that we have now. But many patients are afraid. One of my patients told me that he wakes up in the middle of the night with nightmares of getting COVID again when he goes back to the hospital. So the therapists have to work with the patients, address these issues. We refer them to psychology services as appropriate for that. And then those issues can interfere with the patient's progress in therapy. If they have severe anxiety, it may interfere with their gait, their coordination, and other factors that the physical and occupational therapists have to work with. So at Gaylord, we work as a team and a true interdisciplinary team. It's not just a multidisciplinary team here at Gaylord, it's really interdisciplinary. Our therapists work closely with physicians, PT, OT, speech therapy, psychology, to really address all of the issues that the patient is facing.
Is there anything else you'd like to share with our audience about this program?
I think the key issue is that COVID is a new disease, and the public doesn't really understand that it can have long-term complications, that there is treatment to help. What we didn't talk about yet is how the body can respond in a positive way. We talked about COVID affecting the neurological system, but we have what's called neuroplasticity. So the brain can recover. So the message to therapists, patients, and their families is there is help out there. If you have residual symptoms from COVID, once you've recovered from the acute phase that may mostly be cardiopulmonary issues, please seek help. Go to your rehabilitation facility. There are programs that we can do to help you with your weakness, with your fatigue, with your balance. We can help you work on cognitive remediation strategies to help your brain recover. Occupational and physical therapists can help retrain your nerves and muscles. COVID can cause neuropathies and myopathies that our therapists can really help with. So your physical and occupational therapists have a critical role in terms of COVID recovery. I just don't know that the general population is aware that these services can be provided.
Dr. Kaplan, thank you for making time in your crazy busy day to do this interview and give your colleagues in the rehab professions a look at how Gaylord is responding to the long-term effects of COVID-19.
Thank you very much, Frank, and this is a very important topic, so let's keep it in the limelight. Thank you again.